for joining us. And thank you everyone for joining us today. I'm just gonna switch off my camera and share my screen with you, if that's okay. All right. Oops. Please, can you see my screen at all?
Yep, I can see it.
Yeah, it's up there, Damilola.
All right, thank you. Okay, so thanks everyone. I bring you greetings from Justin Vanny, our Director of Public Health. Today we are focusing on monkeypox. Of course, all of you all have heard a lot in the news that cases are increasing rapidly, and we haven't recovered fully from COVID-19, and now we're talking about monkeypox. But before I delve into this presentation, I'm just gonna touch on briefly what the characteristic features of viruses are, and then explain to us why we are actually seeing this picture. Why are we seeing diseases emerging and reimagine? And then we'll talk about symptoms and control. So if you look at this slide, what can you see? You can see I've pasted 4 microscopic features of viruses. The one on the top left is the HIV virus. The one beneath it is the COVID-19. On the top right is the Ebola virus. And in the middle is the monkeypox virus. Viruses are unique in the sense that, they have the potential to trigger massive outbreaks and pandemics. They've got their own RNA and DNA, they've got their own proteins, but unfortunately for viruses, they cannot survive on their own except they make their way into a host. So it could be an animal host or a human host, but they need a host for them to survive. Viruses cannot survive for too long on surfaces. However, the monkeypox virus is slightly different. So with COVID-19, we did talk about, that COVID-19 could survive on surfaces. Monkeypox can actually linger on surfaces, more than the COVID-19 virus. So you can find monkeypox, on bed sheets, doorknobs, even longer than COVID-19. Non-pharmaceutical interventions that were deployed during the COVID pandemic, such as disinfecting frequently touched points, good respiratory etiquette, and strict hand washing. More than ever, this is the time for us to go back to them, because now we are dealing with a virus that can actually stay for long on surfaces. Another important point I just want to quickly raise is that viruses have the potential to cause pandemics because they can mutate. They have the ability to change their forms, and this makes them unpredictable, giving them the ability to cause outbreaks. So when they mutate, it oftentimes makes it difficult for your immune system to recognize the virus and mount a response to it. Viruses cannot be treated with antibiotics. You need antiviral agents or get vaccinated to prevent infection. Now, this slide, you'd see on the right a picture of sick patients on the ward, and beneath it, this is dead bodies on the streets. This picture was taken many years ago. And what this picture is just trying to tell us here is that many years ago, people died of infectious diseases. Infectious diseases have always been with us for many years. And even just 30 years ago, we had to battle with HIV, Lyme disease, Ebola, Lassa fever, just to mention a few of those viruses. And so whether we like it or not, more infectious agents are still gonna come up, and we need to be prepared for them. In the 16th century, smallpox virus killed nearly 20 million people in Europe, the population at the time. But thank goodness, we should be thankful at least we've got vaccines that can, help reduce morbidity and mortality from viruses. This slide is just to explain why diseases are re-emerging, So when you find diseases re-emerging, diseases that we once thought, oh, we've controlled it, we once thought in public health, these diseases have been controlled, they are found just in certain regions of the world. Why are we now finding them, spreading to other regions? Why are they reappearing? When you find diseases re-emerging, it's just a sign that, it's a warning against complacency. It's a reminder for us to go back to those good hygienic practices. And like I mentioned at the beginning of the presentation, just like with COVID-19, that we were washing our hands, using hand sanitizers, we need to go back. We need to do those things. If I ask us now, how many of us have hand sanitizers in our bags? I'm sure not many of us still, carry them around. So it appears that we have all relaxed and we need to all sit up. Another explanation for the re-emergence of disease is that, we humans are encroaching in the numbers. I mean, because of overpopulation and the need for land space, we all want to have our own homes. We keep moving into the spaces where these animals once made their homes. And for as long as we continue to do that, we will have close contact with certain species of animals that are reservoirs of these infections. We also cannot rule out climate change. We are beginning to see that certain infectious diseases that normally would not even survive under certain, climatic conditions in certain countries are now finding their way. They can now survive in other countries. Again, another thing is that as we humans are evolving, the bugs, the infectious agents also they are evolving, they're changing their forms, as a mechanism for their own survival. With international travel, people traveling to different tourist destinations, we tend to pick infections also from, the countries we visited and take those infections back to our home country. So those are some of the reasons why diseases are emerging. And lastly, another important point I just want to, point to or talk about is our attitude towards vaccination. Let's take our experience from COVID-19. Many communities still do not see a reason for getting vaccinated. And for as long as we continue to, have the attitude of rejecting vaccines, we will make our communities vulnerable for infections to spread. Because we all understand that once the herd immunity in a community is low, many people will become susceptible to an infection. And so those are just some scientific explanations behind the emergence of disease, which I will not dwell too much on. So let's jump right into what monkeypox is. Monkeypox is a viral zoonotic disease. The term zoonotic, used there is because it is primarily a disease of vertebrate animals transmissible to man under certain conditions. So it is a disease of vertebrate animals. Monkeypox is mostly endemic in African countries, but now we are seeing cases in UK and other countries across the world. It is an autopox virus that was first isolated from a colony of sick monkeys in the 1950s. And as at that time, they thought that monkeypox was already spreading in the human population. But it was not until the 1970s that they were able to isolate the virus in a human being in the Democratic Republic of Congo. Out of all the people that had monkeypox in DRC, about 70% of them died of the disease. This just shows that, it's a serious disease. There are 2 strains of the monkeypox virus across Africa, and the strain from West Africa is said to be the less virulent type. Monkeypox and smallpox, are quite similar in the sense that they belong to the same family. So monkeypox and smallpox are similar because they belong to the family called Poxviridae. And the symptoms appear similar also because, the swellings, if you look at the slides, the rashes, are actually pustular, that is, they contain pus in them. They're quite similar. But what makes monkeypox different from smallpox is that smallpox is more fatal. That is, smallpox is likely to cause more deaths compared to monkeypox. And monkeypox affects the palms. You can see that chart on the top right, affects the palms and the sole of the feet. Now, with smallpox, the good news is, smallpox was eradicated in 1980. And when it was eradicated, some of the vaccines that were used for the eradication were kept. As I go on in the presentation, you would appreciate why it was a good idea that the smallpox vaccines were kept, because now we're going to, refer back to them now. So far, over 780 laboratory confirmed cases have been recorded in 30 countries. And out of these 780 cases, almost half have been confirmed in England, because as of 2nd of June, we recorded 348 cases. And so you see that this is serious. We need to take necessary precautions before things get out of hand. I've also, one thing I just thought I'd add is that monkeypox has now been classified as a hazard group 3 organism. Forget about the big grammar. What it just simply means is that it has been classified as a disease that is severe, that can cause serious hazard to employees in the workplace, and can spread to communities. This hazard group 3 organism, that is this hazard group 3 classification, is the same. So monkeypox now is in the same group with HIV, hepatitis B and C, and with Salmonella typhi. So you can appreciate what that tells us. So in the UK, majority of the monkeypox cases were identified amongst the LGBTQ community, especially men who had sex with men, and they were mostly residents in London. But what we found interesting is that those cases had no history of travel to endemic countries. That is, you remember I said that Africa is an endemic country for monkeypox. They had no history of travel to Africa, but what we found is that the current strain of the virus, that has been isolated in England is similar to that of the West African type. The question that I guess will be on our minds now is, why do we have monkeypox in a particular group and not in the general population? Why is it, in this sexual community? So there are different explanations, and what we know is that because monkeypox, the rash from monkeypox, sometimes appear around the genital area, it could be easily mistaken for an STI. And this sexual community, they have very strong links with sexual health services. I mean, I can speak from experience, having worked in different sexual health clinics, that the LGBTQ community, they use sexual health services. They appreciate the importance of, contact tracing, of reporting on time when they have symptoms to prevent spread of disease in the community. And so because we are having them report, it's easier for public health to trace contacts. Otherwise, we might just have monkeypox spreading in the community and we not knowing, only to get to know when it's very late. Also is the fact that, there are many gay festivals, internationally that provides that opportunity for the disease to spread. Is there a possibility that, the infection is spreading in the general population? Yes, it's possible. Anyone can get the virus. It is an infectious disease. And so it's very important that, we use our various platforms to inform people to take necessary precautions. How is it transmitted? In Africa, transmission occurs from exposure to infected animals. So there's something in Africa we call bushmeat. So consuming inadequately cooked meat or handling infected animal products, exposes an individual to monkeypox. Human to human transmission results when you have close contact with large respiratory secretions from an infected person. So, such as during coughing, sneezing, kissing, you can get exposed to monkeypox. But unlike COVID-19, the monkeypox virus is a bit heavier than COVID-19. So COVID-19 could spread via aerosols, and could travel for long distances, thereby, spreading to people. But monkeypox is a bit heavy. So for you to get the infection, you need to have sat with the person for a period of time, for you to inhale and get those infectious agents in. Unlike COVID-19, where we had, flight contact, that sat with an infectious agent on the plane, with monkeypox, so far, we haven't recorded any contacts, on plane. Another way to get monkeypox is that is via close contact with an infected skin lesion. So if you have contacts with, the beddings, clothing, or towels that have been used by an infected person, you're more likely to come down with the disease. And so we tell household members, healthcare workers, those groups of people are more at risk because, a household member or a healthcare worker will want to take care of a sick person, touching the beddings, touching the, the sick patient, and that, puts them at risk. Sexual activity is also another way of contracting contracting monkeypox. I was going to say HIV. Because sexual activity requires skin-to-skin contact, you are more likely to be infected, if your partner is incubating the disease. It is still unclear if monkeypox can be transmitted from genital secretions. I've read some things online about, monkeypox being isolated in semen, but we are still waiting for confirmation from OXA and WHO. But what OXA has said is that as a precautionary measure, you use condoms after coming out of isolation. I'll discuss that in the next few slides. So what are the clinical features? What are the symptoms, of monkeypox? Before I talk about symptoms, I just want to quickly talk about something called incubation period. For those who may be interested to want to know this, incubation period is the time it takes for you to develop the first symptom after getting exposed to an infectious agent. So for monkeypox, your incubation period could be as short as 5 days or for as long as 21 days, depending on your immune status. And so this incubation period, just knowing about incubation period is very important because in public health, it can then help us to trace contacts. And for you as an individual, you can almost predict where you think or the people you think you may have gotten that infection from. So say, for example, you pick up the infection today, you can start thinking backwards, okay, could it be people I've met 5 days before or 21 days prior to the symptoms appearing? So there are two phases of, the infection. In the early stages, which is known as the invasion stage, you develop flu-like symptoms, fever, intense headaches, running nose, muscle aches, and swollen lymph nodes. Okay, so lymph nodes, that we have a lot of lymph nodes in our body. There are some located behind our ear, at the back of our head, some are on the neck, some are in our armpits. Sometimes when you say you have a boil, your lymph nodes, you've got lymph nodes there. So with monkeypox, you get swelling. So you find swellings, you get lymph node swellings. But what I want to point out is if you look at the symptoms listed carefully, you'd know that some of these symptoms can also occur with COVID-19, which just tells us that in the early stages of monkeypox, it might be very difficult for you to differentiate if you've got COVID or monkeypox. And it's been stated that people may sometimes be contagious during this invasion period. So after 1 to 3 days after the fever, rashes then begin to appear. So that's the skin eruption stage, and the rash with monkeypox is quite painful. It affects superficial and deep structures in the body, and is usually concentrated on the face and extremities. Again, during the first week of the rash, the patient is infectious, and we're telling caregivers, families to take precautions. So the highest risk of infection is from the onset of the first symptom until the lesions are totally gone. I know this might not be necessary, but I just thought it might just also be good to differentiate it from chickenpox. I don't know how many of us have had chickenpox in the past. The rash in monkeypox could be easily mistaken for chickenpox, but in monkeypox, what makes it different is the lymphadenopathy, that is the lymph node enlargements you see with monkeypox. And also the rashes in monkeypox, is much bigger, is bigger than that of chickenpox. And again, monkeypox affects the palms. So if you remember this slide, the picture of that child, it affects the palms and the soles, which does not occur with chickenpox. Monkeypox can affect the mouth, eyes, genitalia. And when it starts, the rash starts off as a small swelling and gradually gets bigger. It gets filled with pus, but by 2 to 4 weeks, it begins to dry and form crust. The rash are usually, the lesions are usually in thousands, and they're quite painful. How severe the disease will be depends on your health status. There's still some uncertainty as to whether children or pregnant women or immunocompromised persons, if they're going to have more severe disease, we are hoping to get more information on that. But generally, we know that when your immunity is low, you're more likely to have severe complications. It's also believed that individuals who are less than 40 years are more likely to have severe disease. And it is believed that individuals who have received vaccination against smallpox many years ago should still have some immunity to fight monkeypox. And so we expect them to have milder disease. Remember, I said that monkeypox and smallpox belong to the same family, the Poxviridae family. And so there's that cross immunity, so you having had the smallpox vaccine, there might be some protection. In terms of fatality, so far, no deaths have been reported. We've been informed that it is mild, but complications can actually occur. So I said that, it could affect the eyes. When it affects the eyes, it causes blindness from corneal scary. It could also cause difficulty in swallowing if it affects the oral cavity, that is the mouth. Other complications that also could occur is secondary bacterial infection. So when you keep scratching the rash or peeling the surface of the rash, it gets exposed and to infection, and that can lead to, sepsis and the like. It can also cause chest infection. So those are some of the complications. And of course, complications will be treated in the hospital. So usually monkeypox is self-limiting, not warranting admission, but when complications set in, then, the patient has to be on admission. Just going to move to the next slide now. Right, so when you do develop symptoms, it's very important that you seek health care. The advice is to contact your local sexual health clinic or call NHS 111 for help. I said that the disease can present with complications. So you calling your sexual health clinic and NHS 111 is, to protect yourself and others, because you never can tell how your body will respond to monkeypox. What should we do to stay protected? Well, the guidance is clear. Avoid close contact with infected persons and ensure that infected persons, if you have a family member that's, been exposed, ensure that they call the clinics. Avoid contact with personal items that have been used, by someone that has been infected, such as towels, beddings, cutlery. You shouldn't have contact with that. You want to maintain good standard hygienic practices like hand washing, disinfecting regularly touched points. I mean, hand washing is very important. We've all learned how to wash our hands. So it's very important this time around to wash our nail beds in between the fingers, the back of our palms. And for those who are caregivers, they are advised to wear gloves and protective clothing. For healthcare workers, they have their own personal protective equipment that they're going to use. The guidance says that if you're pregnant or immunosuppressed, you should not care for a sick person, someone who's got monkeypox. So about the public health response. So what is OXA doing? What is the council doing? OXA leads on the investigation of the outbreak, and they will continue to update us on any new developments. About testing, for now, there is no home test kit available for monkeypox. The testing has to be done in a health facility, because the samples that will be taken for the test may be difficult for people to do themselves, because usually, the test, you have to take samples from the skin lesions themselves, directly from the skin lesions, and that needs to be properly, stored using sterile tubes, which you wouldn't want people to do themselves. Well, a lot of work is going on behind the scenes. There's a national OXA incident team in place, and all public communications are managed by them centrally. So for now, we cannot provide you with any case numbers, in a specific region, unless we get a directive from OXA. And there are a series of meetings that are ongoing with OXA and directors of public health, and they will continue to keep us informed of any change in guidance. The council is planning welfare packages for cases who may be required to isolate. So the guidance is that if you have monkeypox, you isolate for 21 days and your contacts should do likewise. So the council is planning welfare packages for that. And, just similar to what we did with COVID-19. And we are working closely with sexual health services to understand, the situation and provide necessary support to ensure cases are well managed. About vaccination. So far, MHRA, which is a Medicines and Healthcare Products Regulatory Agency, they've approved the use of smallpox vaccine. I'm sure most of us must have heard. There's a vaccine called Imnavex, and they've approved it as a post-exposure prophylaxis for monkeypox. So if you have been identified as a high-risk contact, you will be advised accordingly. As much as possible, the target is to vaccinate high-risk close contacts within 4 days of exposure or up until 14 days of being exposed to the disease. It is also being considered, another consideration is, to offer the vaccine as a pre-exposure vaccine for high-risk occupations. So for healthcare workers, they're considering, offering the Imnavex vaccine to them because they are more likely to be exposed whilst they care for sick patients. The vaccine comprises of 2 doses, which should be taken 28 days apart, but the dosage will depend on if you are a community contact or a staff working in a high-risk occupation. And if you have received the smallpox vaccine many years ago and fall under high-risk occupation, you may only be required to take just a single dose. Single doses are also recommended for community contacts. Okay. Well, the current guidance from OXA is for everyone, to be at alert. Monkeypox is now a notifiable disease, meaning you must report, any unexplained, you develop a rash, you must, report to local authorities or to OXA so that we can monitor closely. Cases and households are advised to isolate for 21 days. I've said that. And the guidance is saying that, if you're a household member, you'll be a risk assessment will be done. And even if you've not developed symptoms, you might be required to also be in isolation for 21 days. But whilst in isolation, the cases, should be in a separate room from household members, and you should not share beddings, bathrooms, or anything personal with the infected person. Even cutlery and washing up liquid, I found that very interesting. Even the washing up liquid to wash your cutlery, should be different. And of course, laundry should not be done with the rest of the household. Well, still on isolation, about isolation, in emergency situations, the guidance says that, infected persons can actually go out only if it is an emergency. And when they do go out, they must wear long sleeve shirts, full length trousers, ensuring that their body is well covered. And they're advised to wear a surgical face mask or a double layered face covering. And about sexual activity, the guidance also says that, if you're infected, abstain from sexual activity until you're out of isolation. So until after 21 days, when you're out of isolation, you shouldn't engage in sexual activity. And when you do recommend sexual activity, you must use condom for a period of 8 weeks. So there has to be that barrier for a period of 8 weeks until your rash has fully scabbed and fallen off. So it is just a precautionary measure. So don't have sexual intercourse during isolation. And once you're out of isolation, you use condoms for another 8 weeks until the rashes have disappeared. Well, all through when you're in isolation, or if you have any sick member, any household member that is sick, when they're in isolation, to be very helpful, they take in lots of fluids, nutritious food, and most importantly, to not peel off, the rash or peel off the scabs. Cases can come out of isolation after 21 days if there have been no high temperature for at least 72 hours or no new lesions in the previous 48 hours. Okay, before I go to the last slide, I just wanted to also say that OXA has also advised that sex on premises venues, so venues where sexual activities are likely to take place, such as saunas, dark rooms, glory hole, sex clubs, they must be vigilant and ensure disinfection and proper waste disposal. So as local authority, we are monitoring the situation. We'll continue to update you on any change in guidance using our existing communication channels. On a final note, I just want to end here. Just the key things for us to remember is that monkeypox is infectious. We must continue to remain at alert. And it has not yet been declared as a sexually transmitted disease, even though, the precaution is there for you to use condoms. And about declaring the number of cases in Birmingham, once we get a directive from OXA, we will inform you accordingly. Thank you very much. Handing over to Jordan. Thank you all for listening.
Thanks, Damilola, for a really interesting presentation. I've actually taken over for Jordan. We're co-chairing today, if that's okay. Yeah, thank you again for your presentation. Really interesting. I found really interesting, particularly the history around zoonotic diseases and the fact that we're moving from, that virus spreading from animals to humans, from now humans to humans. It's very, 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 very fascinating. So we have a few questions in the chat. I'll just go through them one by one, if that's okay, and make sure we try and keep to time. So the first question is from Nina, and she's asking whether you can, I guess, catch monkeypox through changing your footwear. Maybe you might. I know that I always wear other people's shoes in the house. Is that one way that you may see kind of that contact between maybe a fabric and skin?
Yeah, that's a very good question. And if you remember during the presentation, I talked about getting the infection from beddings. So that was why I started with viruses, how they're able to survive on surfaces. Monkeypox especially can actually stay on beddings, towels, personal items far longer than COVID-19. And the rash from monkeypox has got pus. It's got pus in them. So imagine the pus on a footwear and you using that footwear, you will be exposed. So the advice is avoid personal items.
Can I ask another question? Can I ask another
Yeah,
question?
of course. Yeah, of course.
It's
Nina,
quite,
go for it.
so what is health authority doing with places of worship where you have to take shoes off and that you have to wear, because there's a place of worship around me. So they're saying you have to take your shoes off. You can't take it into this place. There's a particular place, but you can wear flip-flops, somebody else's flip-flops. And that's a cause for concern for me. So I raised that with them.
Yes, so first things first, what I'm going to say is, if you've got symptoms, House of Worship should send the information around. If any of their members have got symptoms, remember the symptoms I talked about, the early symptoms and also the late symptoms. If you've got symptoms, you shouldn't go to a place of worship because then you're putting other people at risk. And now more than ever, we all need to disinfect our premises more often. So using bleach agents, our usual disinfectants, you need to do that more often. And I'd advise that we avoid, this period, we avoid, it's not stated in the guidance, but I think it's safe to avoid sharing personal items, just to be as a precaution.
But is the health authority doing something with the places of worship to give them that kind of advice that this is what they should be doing and this is what they shouldn't be doing?
Yes, so that is why we're having this webinar. So this, we've invited faith leaders. I believe some of them should be present today. And we've been sending out newsletters. We do that on a weekly basis, giving people the right information they need to stay protected. Thank you, Nina.
Thanks, Nina, for your question. Elaine had a question around household isolation for 21 days, which you mentioned in your presentation. And I guess just to also put that in the chat, I've also put the reference to the guidance from the government website, which goes into a little bit more detail around isolation for the household, as well as other information around symptoms, etc. And I guess just to reiterate on Damilola's behalf, if that's okay, that she mentioned that there'll be a conversation. There is a contract tracing team in place now, so they'll be in touch, and I guess they'll speak to the patient and their household to determine what the best steps are, again depending on patient safety, on whether they're symptomatic, whether they've got symptoms, etc. So there you go, Elaine. Hopefully that answers your question for you. Sandra asks whether the rash is likely to leave scarring.
Well, it might, but I'm unable to give you an answer on that. But yes, like with chickenpox, we do know that it leaves scars. There might be scars, unfortunately. But as we get more information about the disease, we'll let you know.
Great,
hope that answers your question.
Are there any further questions for Dr. Akinsulire while she's on the call now? Those are the end of the questions in the chat. Please feel free to put a message in the chat, or if you're feeling brave, you're welcome to put your hand up as well.
I think I have a question. I just wanted to ask if we have any of our faith leaders present today. Though this webinar is recorded, so we can always give them access. Okay. All right. No questions?
Okay. If that is the case, then I will call this meeting to a close. Thank you very much to everyone who has attended today. Is Mindy. Mindy, do you want to make a quick announcement to the group? Maybe just introduce yourself as well so people know who you are.
Hi everyone, my name is Mindy and I'm the PR and Comms Officer for Public Health. So it's just to give you a bit of an update that the COVID Champions is transitioning to bolder, healthier champions. We are putting some information up in the background on a website, so that should be ready by the end of this week. I'll be chatting to Sean and the team in a bit more detail about that, about what's going to happen in the next steps going forward. So it's just a quick heads up that if anybody's got any questions around it, there's a lot of work happening in the background, so there will be updates going forward and we'll let you know about it.
Yeah.
Great, thank you. And again, please do keep a lookout in the newsletter that goes out every couple of weeks. There's lots of information around monkeypox, other ways you can keep yourself well, and of course, any updates like Mindy's just mentioned around some of the other types of engagement you might want to take part in. So with that in mind, keep well, keep safe, and please do get in touch if you have any question at all. Take care, everyone, and thank you for attending. Bye.
Thank you, everyone.